question blomi golong hardworking Minister of Health. Before me asking question blomi me Salim people talk sorry on behalf of my people, on the relatives, families, people of Goilala, Central Province, and the member of this Parliament, people of Papua New Guinea, on the passing of one of our hardworking members and the minister who recently passed away, William Sam. We thank the Lord for his life and his service to our people. My question is regard to COVID in the country. To date, total cases for COVID stands at around 41,000. Deaths around 639. That's the latest data. The questions are, firstly, can the minister say today on this floor, is COVID still a threat to the country or not? Secondly, what is the government position or plan? We see the election coming up. What is the government plan today with regard to COVID during the election period? Thirdly, what's the government position on the national the COVID center? Will the government continue to keep the COVID center or not? Should you now see the need to disband the COVID center and allow the police commissioner to concentrate on the election now? And thirdly, fourthly, recently during Joint Parliamentary Committee on Public Sector Reform and Public Accounts Committee, there was we know that there is the procurement that is still held at the NPC for the last 8 months on the medical supplies. Is the minister aware of this delay by NPC to allow the contract to go through or not? If you know, what is the department doing about this? Because we see the need for health. I mean, the medical supplies to be transported to many of our health facilities. Thank you, Mr. Speaker.
Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the good member for Pomio for his series of questions. Firstly, the question on COVID. COVID is still very much a threat in our country. The government has put policy in place to ensure that we carry on with life. So the new Plapasin will now go into a new way of living, that we live with the knowledge that COVID-19 is within our country. The isolation centers will still be open. We have different variants and mutations that continue to enrage some of the places in our world. So we have to be ready to ensure that it doesn't come into our country. The NCC, the National COVID Center, it will be transitioning into a public health safety authority from what it is now, and the controller's position will go back into a public health and safety position. With the NPC, I don't control the NPC, but my secretary has been in contact with NPC to ensure that the procurement process is followed. I can't speak on behalf of NPC, but I've been told that the NPC are going through the legal programs to ensure that the procurement process is followed and they come out with an answer. With that, I thank the member for Pomio for his questions. Thank you.